if you have melasma, and what I would recommend if you were one of my clients and you came in and you said, hey, fix this. So first things first, we have to remember that melasma is an internal and external factor, which means that it can be brought on from heat, hormones, stress, medication. There's a lot of factors at play here. So first things first, I would make sure we're not pregnant, we're not nursing, anything like that. If we were, then there's other things that I can do, but I want to make sure she's not doing any of those things, so then I can make sure that her and baby are safe. Second thing, I would make sure I get her on a pigment inhibitor, whether we get her on one from Epicurious or one from Skin Better. Those are two of my favorites. Essentially, what a pigment inhibitor does is it fights your body's inflammatory response that it's using to create the pigment. So we want something that's going to go in there and basically tell that inflammatory response to stop producing it, because for some reason, those melanocytes, which are the pigmented cells here, they're wanting to produce pigment in areas because they think that they are protecting you. So we want to make sure that we can calm that down, and I would get her on one of those as soon as possible. The next thing I would make sure that she's wearing sunscreen morning and night, because sunscreen is essential whenever you have melasma. Tinted is always going to be best because those iron oxides will actually act as an additional shield, making sure that you don't get extra pigment. Next thing would be is to add her on a very baby chemical exfoliant to start her off with. So whether I would get her on a retinoid or glycolic or lactic acid, or we could always do alpha from Skin Better, so that I can make sure that she can get the best results and we can start overturning those skin cells faster, so then we can work on this melasma. Treatments I would recommend doing in the treatment room. First, I always say with melasma, home care is number one, and then skincare treatments. So once she felt really, really good about her home care and I felt like she was using it for at least 6 to 8 weeks, then I could consider doing a very, very mild glycolic, lactic acid, maybe kojic acid baby peel. We can see how the skin responds to that. We can look into if we need to do harsher peels, so then we can get her the best results. But just know that melasma is one of those things that takes time and it's not a quick fix.